Welcome to another Recovery of the Month with Fortress Physical Therapy. Dr. Amy here with you guys today. We do need perhaps two pieces of equipment. One would be a band, something that's a little bit thicker than usual, and something to tie this to that's very sturdy. Maybe it's a railing in your step of your house. If you have a two-story home, usually there's a railing going up. Or a pull-up bar that you might have something that's solidified into the ground, or a pole, or even a tree stump of some sort. So today's focus is going to be on the shoulder complex, or that ball and socket joint of the shoulder, as well as getting into this kind of nice elongation into the lat or the side muscles of our body. Our lat muscles are very strong puller muscles. So we're going to focus on that as well today. A couple different movements. We have 4 of them. First one is standing repeated shoulder internal rotation with the strap. The next one's going to be a 60-second hold of what I term a deep front line stretch that kind of gets all the way into the front, even into the hip flexor. So that's where this attaching this band to something is going to come into play. If not, you can totally do it without. And then 2 more at the end where we get a little bit of rotation into the spine, as well as some wrist movement at the end. So first movement, we're going to take this band and you're going to hang it over, let's say, your right shoulder. The left arm or left hand is just going to hang out in the band, just like that, or I like to kind of have it like this, where my hand is in the loop, my wrist is in the loop, and all I do is just kind of hang on just like so. So 15 standing banded, repeated shoulder internal rotation. So internal rotation is how I have my hand right now, internally rotate, or the back scratch test. So what I'm gonna do, I'm gonna use this other arm to kind of bring it up as high as I can, just kind of giving myself some pressure on, pressure off, pressure on, pressure off. I'm going to do 15 of those, 15 on the right, 15 on the left. So here's something I'm thinking about. When I bring this shoulder or this hand up my back, my front shoulder or my natural posture is going to want to do this. We don't want that, okay? I want to try to zone in on much of the shoulder joint as I can. So I like to think or tell patients, if my shoulders had headlights, they shouldn't deviate. One shouldn't be pointing down, the other one shouldn't be up. I shouldn't be like this, I shouldn't be off to the side. I like to stand nice and tall. And I think neck posture with this does matter. I'm gonna do a couple more just for time's sake, but you can kind of see. I'm gonna do one more after this, and I'm gonna hit a couple on my other shoulder. Just pressure on, pressure off. My band, the band is doing the work. The shoulder that I'm stretching, it's just hanging out. So I'm gonna switch sides. For verbal setup, I'm just going to throw this band over my left shoulder. My right hand, internally rotate or scratch. It's gonna hang out in this band, and then I'm just gonna grab it like this. Just like that. Kind of create a sling for it. I'm just going to drag it up my back, just kind of pressure on, pressure off, pressure on, pressure off. Again, focusing on my posture, not letting that shoulder or my posture to kind of get into this kind of very unoptimal position, right? Nice upright. My shoulders had headlights. They're pointing forward. I'm going to do about 3 more on this one. Then we're going to get into this where we need to attach the band onto something. I'll do 2 more. So I'm going to finish with this. Now getting right into this position can be very vulnerable, very sticky, it could be painful. Take your time getting into it. Take your time. Don't abruptly just bring that arm or that hand right up the back. All right, so I'm going to hang this to my pull-up bar. Next movement is this deep front line. So what I'm going to do, we're going to go right arm. We're going to hold this for about 60 seconds. Right arm's going to hang just below that bend point. And then I'm just going to kind of hang on to my band like this. Now, if my right arm is in this band, I'm going to kneel on my right knee. So I'm going to get into this half kneeling position. So it takes my arm, and I can already feel a stretch now. I'm just going to make sure this band stays where it needs to, so I might need to bring it up onto my triceps muscle. Let me adjust this. There we go. And I'm in this half kneeling position, and I'm really just going to kind of let the band stretch this whole front. And I'm just going to breathe. I'm not going to overextend my lower back. Kind of getting a little bit of a hip flexor stretch. Now, if I want to, sometimes it might pinch that area. I have to kind of hold it a little bit. My skin's a little slippery right now. It's warm in here. So I'm just hanging, making sure the band stays where it needs to be. Another thing too in this position, just for fun, if I want a little bit different stretch on my arm, I'll kind of cross it over me. I'm still getting this hip flexor stretch, but it's just a different way to kind of like tap into this lat muscle of my body. So again, you're going to spend about 60 seconds on both sides. I'm going to do a little bit on the other side. Maybe I can kind of switch this and be on this side position. So I'm going to go left arm, which means I'm going to kneel on my left leg and get into this elongated position. Now a little bit different because of where my axis is and how I'm showing you guys. But again, hopefully you can see a little bit of my back, like I'm not overarched. I'm trying to maintain a little bit of a good posture here. And then that band, I'm just letting it kind of pull me up. And then I might kind of switch that in front of my body like how I showed prior. But really for optimal positioning, you probably want to be where the axis is behind you. Now this is just for viewing purposes, but if I can get kind of more in front here, there we go. That band's going to pull me back, but then I don't want to overarch that lower back. So you can see how much elongation I'm kind of getting onto my left side. That is what you want. You want that axis behind you. All right. So this leads into two more movements. We're still going to get into that half kneeling position. So I'm just going to switch to the other side. I call this the thoracic spine or mid back rotation prayer stretch. Very, very good movement. So I'm going to show you from a frontal view here. I'm going to get back onto my right knee, and I'm going to a little bit kind of lunge forward. I'm going to take prayer hands. I'm on my right knee. I'm going to take my right hand and rotate over my left side. So I'm really going to get my triceps like this, and then I'm going to take my hands and make prayer hands. And what I'm going to do, oh yeah, I feel this stretch like all the way in my back, up to here, even in between my shoulder blades. I'm going to hold this position for about 60 seconds if we can. If I want a little bit more of a deeper stretch, I'm going to take my top hand and push push into my bottom hand. So then it rotates me even more. Oh yeah. So again, we're going to spend about 60 seconds here, but I'm just going to switch sides so you can kind of see. I'm going to maybe be at this, a little bit of this like profile position. So I'm going to go on my left knee. Now I'm going to take my left triceps, go over my right knee, top hand prayer stretch. I'm going to push my right hand into my left. Oh yeah. Take some deep breaths here. See how my arms are straight with each other or parallel, or they make one, like a line. That's what you want. We don't want to be off like this. If I can get my elbow, make a good prayer position, that's where it's at. After 60 seconds is up, we're going to take a little bit of a load off our knees. And we're going to get into this, what we call this quadruped position. Quadruped just means you're on all fours. We're going to do rocks. So this is more for like wrist mobility or stretching. A couple different ways that you can do this. You can have palms down, fingers forward, and just kind of rock over that area to get into this, what we call this wrist extension. So that's going to stretch the underside of our forearm. So I'm really just kind of keeping my elbows locked. Hands are flat. My body weight is shifting over the palms of my hand, and I'm feeling that stretch into my forearms. So I'm going to do 30 rocks, but 15 forward, 15 back. I'm just going to shorten that for you. After those 15, I'm going to flip it. So I'm going to put the back side of my hands as flat as I can on the ground. Now I have some pretty good mobility here, and my fingers are facing me. So instead of rocking over, I'm just reversing it. I'm going to rock back gently. Now I'm going to feel this nice stretch on the front side of my arm. Pressure on, pressure off. Again, I'm going to do 15 rocks like this. And I'm going to show you one more alternative way to kind of kill two birds with one stone, because you can rock back and forth here. This can be a gnarly position for people, especially if they don't have the wrist motion or the flexibility in their forearms. Usually you'll see this in a lot of the male population just because they have more muscle than ladies. All right, I'm going to show you a different way to do this. So showed you hands forward like this, and then we're here, hands forward like this. Kill two birds with one stone. One hand's going to be down, the other one's going to be up, just like this. I'm going to rock forward towards that right hand, then I'm going to rock back towards the left. So this is another great alternative. You can do 15 this way. And then after you hit those 15, just reverse your position. Again, with the fingers facing me, you're going to feel that stretch on this portion of your forearm, while the palm down, fingers out, facing away, you're going to feel that stretch more on that underside. And you're going to do 15 there. So a nice alternative. Speaking of alternative, if we don't have access to a band and we get into that half kneeling deep front line stretch, that's okay. Here's the alternative. You just mimic the motion or the position. So if I'm on my left knee, I'm just going to get into this nice little like Samson stretch. Then I might lean over to one side. It's not going to be as effective because you have to be more active in this position, but you're still getting that deep front line stretch that leads into the lat muscle. But one good thing, piece of arsenal to have in your gym or home gym, as well as something to attach it to. So those are the said movements. We have 15 internal rotation stretching with the band, 15 on the right, 15 on the left. That deep front line stretch that I just mimicked the alternative for, as well as the use of the band, 60 seconds on the right, 60 on the left. And then that half kneeling prayer position stretch, and then ending with those quadruped wrist flexion and extension mobility movements.